So now we're going to start one last module in the lower limb, the layers of sole and the arches of foot. Again, from these modules, recent exams, I'm saying last 4 to 5 years, we didn't get any question from this module. But again, this is our favorite topics for the AIMS exam, that is INSCT exams. So you may get in the, yes, INSCT exam. Now, first one, layers of sole. Now, we have 4 layers of sole. Now, each layer have own muscles, and these muscles are supplied by nerves. Now, these layers arranged from superficial to deep. So, in the first layer, we have 3 muscles. What are those? See, just remember the muscle name and the nerve supply. That is more than enough. No need to know the exact origin insertion for these muscles. Definitely, they won't ask any of that. Muscle in each layer. Muscle. What are the muscles in the first layer? All the following muscles are in the third layer, except which of the following is not present in the second layer. Now, this muscle is not supplied by medial plantar nerve. All the following are supplied by lateral plantar nerve, except. Likewise, only we get the questions. So, try to know the muscle name and the nerve supply. That is more than enough in each layer. Okay. So, first layer, 3 muscles. What are those? Abductor hallucis muscle, and abductor digiti minimi, and flexor digitorum brevis. Okay, one muscle go to the thumb, abduct the thumb, abductor hallucis, and one muscle go to little toe, abductor digiti minimi, and in between, yes, flexor digitorum brevis. Okay, first layer. Now, second layer. Second layer, we have 2 tendons and 2 muscles. Second layer, 2 tendons and 2 muscles. What are tendons? Your flexor hallucis longus and flexor digitorum longus tendon. See, these 2 tendons coming from leg. Yes, posterior compartment of leg. The posterior compartment of leg, we have 4 muscles: popliteus, flexor digitorum longus, flexor hallucis longus, and tibialis posterior. 4 muscles we have. In that, the flexor digitorum longus and flexor hallucis longus from the posterior compartment of leg come to the sole. Second layer of sole. Now, what are the muscles? Now, from flexor digitorum longus, lumbrical muscle take origin. We have 4 lumbricals, 1, 2, 3, 4. Okay, and we have quadratus plantae muscle. Quadratus plantae. That muscle is quadrilateral shape in the plantar region. Quadratus plantae muscle. Now, see the lumbricals. Now, lumbricals, we have 4 lumbricals. Okay. Now, see the first lumbrical. First lumbrical, it is taking origin from only one side of flexor digitorum longus. So, first lumbrical is unipinnate. First lumbrical is unipinnate. Remaining 2, 3, 4 lumbricals are bipinnate. In the upper limb, in the palm region, lumbricals 1 and 2 unipinnate, 3 and 4 are bipinnate. Yes. Here in the lower limb, in the sole, first lumbrical is unipinnate. Lumbricals 2, 3 and 4 are bipinnate. Clear? Right. Now come to third layer. Now in the third layer, we have flexor hallucis brevis. Okay. Flexor digiti minimi. And one more muscle, adductor hallucis. Okay. So one muscle to great toe, flexor hallucis brevis. One muscle to little toe, flexor digiti minimi. And one muscle adducts the great toe, adductor hallucis. Now come to fourth layer. Now in the fourth layer, we have plantar interosseous and dorsal interosseous. Now, plantar interosseous 3 in number, dorsal interosseous 4 in number. Plantar interosseous unipinnate. Plantar interosseous unipinnate. Dorsal interosseous bipinnate. It is same like palmar interosseous and dorsal interosseous in the palm. Palmar interosseous unipinnate, dorsal interosseous bipinnate. Same way, plantar interosseous unipinnate, dorsal interosseous bipinnate. Again, palmar interosseous 4 in number. The first palmar interosseous, it is rudimentary. But here, in the plantar interosseous, the first interosseous is absent. So, we have only 3 plantar interosseous. Okay. So, we have 3 plantar interosseous and 4 dorsal interosseous in the sole, fourth layer. Now, another difference is, now in the palm, the axis is passing through, the central axis is passing through middle finger in the palmar region. But in the sole, the axis is passing through the second toe. That means all the fingers, they move towards the second toe only. The abduction and adduction of the toes, it is through the axis of the second toe only. Okay, right. Now, what is a nerve supply? See, nerve supply, we're going to write some story here. What story? Now, the tibial nerve, which pass below the flexor retinaculum of the leg and enter the sole. Now, in the sole, which is divided into medial plantar nerve and lateral plantar nerve. Medial and lateral plantar nerve. Now, this medial plantar nerve and lateral plantar nerve will give complete sensory supply and motor supply to the sole. Very important. Okay. So, all the muscles in the sole supplied by medial and lateral plantar nerve. The complete sensory supply to the sole, it is carried by medial and lateral plantar nerve. So, now we're going to see what are the muscles supplied by medial plantar nerve and what are the muscles supplied by lateral plantar nerve, which is exactly like the palmar region. Now, in the palmar region, the muscles are supplied by median nerve and ulnar nerve. Okay. All the muscles in the palm, majority of the muscles in the palm supplied by ulnar nerve. The median nerve in the palmar region supplies only 4 muscles. We know the mnemonic LOAF. So, these 4 muscles are supplied by median nerve in the palmar region. Remaining all other muscles are supplied by, yes, ulnar nerve. Same way, all the muscles in the sole are supplied by lateral plantar nerve. All the muscles in the sole supplied by lateral plantar nerve, except 4 muscles. We're going to see those 4 muscles. Don't worry. Mnemonic is LAFF. Now, these 4 muscles are supplied by medial plantar nerve. Medial plantar nerve. So, medial plantar nerve is like a median nerve in the palm, supplies only 4 muscles in the sole. Now, the question is, now what is a dominant nerve in the palmar region? Very good. Ulnar nerve. Ulnar nerve supplies all the muscles in the palm except loaf muscles. Similarly, what is a dominant nerve in the sole region, plantar region? Very good. Lateral plantar nerve. Lateral plantar nerve supplies all the muscles in the sole except 4 muscles. LAFF. These 4 muscles supplied by medial plantar nerve. So, medial plantar nerve is like median nerve in the palm. Clear? So, now we're going to see the muscles supplied by medial plantar nerve. Now, come to layer number 1. Now, layer number 1, the abductor hallucis supplied by medial plantar nerve. Flexor digitorum brevis supplied by medial plantar nerve. Okay. So, these 2 muscles supplied by medial plantar nerve. Okay. Right. So, in the first layer, 2 muscles. What are those? Abductor hallucis muscle and flexor digitorum brevis. These 2 muscles supplied by medial plantar nerve. Fine. Now, come to second layer. Now, the second layer, we have lumbricals. Now, in the upper limb, in the palmar region, we have 4 lumbricals. 1 and 2 lumbricals are unipinnate. They are supplied by median nerve. 3 and 4 lumbricals are bipinnate, supplied by ulnar nerve. Very good. Now, in the sole second layer, we have 4 lumbricals. First lumbrical is unipinnate, supplied by, very good, medial plantar nerve. I told you. Medial plantar nerve, it is like a median nerve. So, first lumbrical, unipinnate, supplied by medial plantar nerve. So, in the second layer, only 1 muscle supplied by medial plantar nerve. Lumbricals 1, unipinnate. Now, remaining lumbricals and the remaining muscles, quadratus plantae, they are supplied by lateral plantar nerve. Lateral plantar nerve. Okay, right. Now, third layer, flexor hallucis brevis. This muscle is supplied by medial plantar nerve. Okay, only 1 muscle in the third layer, flexor hallucis brevis, supplied by medial plantar nerve. Remaining all other muscles are supplied by lateral plantar nerve. Again, fourth layer, plantar interosseous, dorsal interosseous, they are supplied by lateral plantar nerve only. Okay, so mnemonic, I told you, muscles supplied by medial plantar nerve in the sole. Muscles supplied by medial plantar nerve in the sole. I told you mnemonic LAFF. Median nerve, loaf. Medial plantar nerve, mnemonic is LAFF. L means lumbricals. Lumbricals 1. A, abductor hallucis. F, flexor hallucis brevis. F, flexor digitorum brevis. Flexor digitorum brevis. So these are the four muscles supplied by medial plantar nerve. Remaining all other muscles are supplied by lateral plantar nerve. Now we're going to see some applied. Applied is Martin's neuroma. Martin's neuroma, it is the most common form of nerve enteropathy. Which nerve, sir? Third common digital nerve. Third common digital nerve, a branch of medial plantar nerve. Medial plantar nerve. It's a nerve entrapment of the third common digital nerve, branch of medial plantar nerve. And one more applied is Baxter's neuropathy. Now, Baxter's neuropathy, it is due to the entrapment of Baxter's nerve. Now, what is the Baxter's nerve? Baxter's nerve is inferior calcaneal branch. Inferior calcaneal branch of lateral plantar nerve. Okay. So, the lateral plantar nerve is giving inferior calcaneal branch, that nerve entrapped, which in turn result in Baxter's enteropathy. So, Baxter's nerve is our inferior calcaneal branch of lateral plantar nerve, entrapment of this nerve, which in turn result in Baxter's enteropathy. Okay, right. That's all about the muscles in the sole and the nerve supply and the apply. Now next we're going to start the arches of foot. So now next we're going to start the arches of foot. Okay, so now the foot is not a flat one, it is arched. Now why it is arched, sir? Is there any specific function for these arches? Yes. Now these arches act as the shock absorber in stepping and jumping movements. Number 2, it helps in proportional body weight distribution to the weight bearing toes. Number 3, it adapts to the foot when you walk on the uneven surface. And number 4, it also protect the plantar vessels and nerve. Now how many arches we have? We have 2 arches, longitudinal arches and transverse arches. Longitudinal arches and transverse arches. So 2 we have. Now transverse arches, it is transverse in nature, horizontal in nature. It is not that much concave. So we are not bothered much about the transverse arch. Now we're going to discuss the longitudinal arch. Now longitudinal arch, we have 2 in number, medial longitudinal arch and the lateral longitudinal arch. And that is what we're going to see now. Now we go one step by step. First one, you have to know what are the bones forming the arches. So now first I told you we have medial longitudinal arch and the lateral longitudinal arch. Now what are the bones forming the medial and the lateral longitudinal arch? Now see the diagram. Now this is medial side and this is lateral side. Now medial longitudinal arch is formed by the medial part of calcaneum bone, number 1. Number 2, this is talus bone. Number 3, navicular bone. Number 4, 5, 6, cuneiform bones, medial, lateral, intermediate cuneiform bone. 7, 8, 9. 7, 8, 9 are the first 3 metatarsal bones. These are the 9 bones forming the medial longitudinal arch. So please write number 1, medial part of calcaneum bone. Medial part of calcaneum. Number 2, talus bone. Number 3, navicular bone. Now 4, 5, 6. 4, 5, 6. Medial, lateral and intermediate cuneiform bone. Intermediate cuneiform bone. And 7, 8, 9. First 3 metatarsal bones. Metatarsal bones. So these are the 9 bones forming the medial longitudinal arch. Right. Now what about the lateral longitudinal arch? Now lateral longitudinal arch is formed by, we use some other color, blue color, lateral part of calcaneum. Okay. And then lateral part of calcaneum. Okay. And then this is cuboid bone. And this is 4th and 5th metatarsal bones. So lateral longitudinal arch is formed by lateral part of calcaneum bone, lateral part of calcaneum bone, okay, cuboid bone, and 4th and 5th metatarsal bones. 4th and 5th metatarsal bones. These are the 4 bones forming the lateral longitudinal arch. So 9 bones forming the medial arch and 4 bones forming the lateral longitudinal arch. Clear? Right. Next, pillars. The anterior pillar and the posterior pillar. That means Pillar means the anterior and the posterior end of the arches. Okay. So medial arch, the anterior pillar is formed by the head of first three metatarsal bones, and the posterior pillar is formed by the medial tubercle of the calcaneum. Please write pillars. So pillars means the anterior and the posterior end. Now anterior pillar of the medial longitudinal arch is formed by the head of first three metatarsal bones, and the posterior pillar is formed by the medial tubercle of calcaneum. Medial tubercle of calcaneum bone. Okay. For lateral longitudinal arch, the anterior pillar is formed by the head of fourth and fifth metatarsal bones, and posterior pillar is formed by the lateral tubercle of calcaneum. Lateral tubercle of calcaneum. Okay. Yes. This is anterior pillar and the posterior pillar. Fine. Next, the summit and the joint of the arches. Now, what is meant by summit? See, summit is nothing but it is the highest point of the arch. See, highest point in the sense that is the bone which takes the weight first, and then the weight is distributed equally to the other bones. So the summit is the highest point or the first bone which takes the weight. Now, what is the highest point of the medial longitudinal arch? Now see the diagram. In the medial side, which bone is the peak? Which bone is at the highest point? Summit is also called as peak. Summit or peak or the highest point. Which bone on the medial side? See the diagram? Yes, very good. It's very obvious. Talus bone, it is the summit of medial longitudinal arch. Okay. Now, what is the joint, sir? Now, joint of medial longitudinal arch. The joint between calcaneum bone, talus bone and navicular bone. That is talocalcaneo-navicular bone. Talocalcaneo-navicular bone. It is a joint of the medial longitudinal arch. Now, what type of joint is talocalcaneo-navicular? Please remember, talocalcaneo-navicular is ball and socket joint. It is ball and socket joint. 2017 November AIIMS exam question. Very old question. They gave you in 2017 November AIIMS exam. Okay. Right. Now come to the lateral arch. Now see the lateral arch. For the lateral arch, lateral longitudinal arch, the summit, the peak or highest point is formed by lateral arch. We have only four bones: calcaneum, cuboid, fourth and fifth metatarsal bone. The highest point, peak or summit is formed by this bone only, calcaneum. So calcaneum bone, it is the bone which form the summit or peak. Okay. Right. Now, the joint of this arch. What is the joint of this arch? The joint between calcaneum and cuboid. Calcaneo-cuboid joint. Calcaneo-cuboid joint. It is a joint of lateral longitudinal arch. Okay. Right. Now, for the calcaneo-cuboid joint, we have one specific naming ligament. That ligament is called Chopard's ligament. So, Chopard's ligament, it is a ligament of calcaneo-cuboid joint. Okay. So, Chopard's ligament, the stem is attached to which bone? Calcaneum bone. So, from calcaneum bone, the stem bifurcate. One goes to navicular bone, another comes to cuboid bone. So, what are the two parts of Chopard's ligament? The Chopard's ligament contains two parts. What are those? Calcaneo-navicular part and calcaneo-cuboid part. So, we have two parts for the Chopard's ligament. Okay. Right. So, now we know the joint and we know the submit. Now, next one, we have intersegmental ties or the ligament support. So, what the ligaments will do? See, ligaments will tie these bones. I told you we have bones, calcaneum, talus, navicular, cuneiform, metatarsal bones. Now, we need some ligament to hold these bones. Who will do that? The ligaments will do that. So, ligament support or intersegmental ties. Intersegmental ties. Intersegmental ties. Same only. So, ligament or intersegmental ties, yes, for medial arch and lateral arch. Now, we have a ligament on the medial side. Which ligament, sir? For medial longitudinal arch, the intersegmental ties is, the ligament support is given by our spring ligament. Spring ligament. Now, spring ligament, what is the other name for spring ligament? Now spring ligament is coming from which bone to which bone? Now can you see this bone here? That is the sustentaculum tali of calcaneum bone. From there, the ligament goes to navicular bone. This ligament is not seen clearly in the medial view. You will see this ligament more on the plantar side. So this ligament is also called plantar calcaneonavicular ligament. That is the other name for spring ligament. See, now we don't have a JIPMER exam. We have only INACET. But this question was asked repeatedly in the JIPMER exams. 2017, 18, 19, I'm saying. This question asked repeatedly the JIPMER exam. The other name for spring ligament is plantar calcaneonavicular ligament. Okay. So now I told you the plantar calcaneonavicular ligament or spring ligament, which is coming from sustentaculum tali to the navicular bone. Okay. Now the spring ligament is giving support to which bone, sir? See here. Now this is calcaneum bone, and above that you are seeing the talus bone. So spring ligament is giving support to head of talus. The another function, spring ligament, which is giving support to head of talus. So spring ligament is giving support to the head of talus bone. Okay. I told you this ligament is starting from sustentaculum tali of the calcaneum. Now sustentaculum tali of the calcaneum is nothing but it is the projection on the medial side of the calcaneum bone. Medial side of the calcaneum. Okay. Now below the sustentaculum tali, you are seeing the groove. That groove is for flexor hallucis longus tendon. Very important. Okay. So we have a groove below sustentaculum tali. That groove transmit flexor hallucis longus tendon. Now sustentaculum tali also gives attachment to three ligaments. What are those? Number one, I told you spring ligament, plantar calcaneonavicular ligament, attached to sustentaculum tali. Sustentaculum tali also receives two more ligaments. What is that? Deltoid ligament, tibiocalcaneal part, and number three, medial talocalcaneal ligament, from talus bone to calcaneum bone. So we have three ligaments attaching sustentaculum tali. Very old question. You may get this. All the following ligaments attached to sustentaculum tali of the calcaneum except. So sustentaculum tali, the projection on the medial side of the calcaneum bone, receives three ligaments. What are those? Plantar calcaneonavicular ligament or spring ligament, deltoid ligament part, tibiocalcaneal, and medial talocalcaneal ligament. Okay. Yes. So now the point is the spring ligament, it is giving the ligament support to the medial arch. It is forming the intersegmental ties for the medial arch. Okay, sir. Now what about the lateral arch? Now for the lateral arch, we have plantar ligaments, long and short plantar ligaments. For lateral arch, lateral longitudinal arch, the intersegmental ties or there's a ligament support is given by this is long plantar ligaments, and just below that we are seeing short plantar ligaments. Long and short plantar ligaments. Long and short plantar ligaments. Okay, right. Shall we proceed? So ligament support for the lateral arch. The intersegmental ties is formed by short and long plantar ligaments. So next the tie beam and the sling support. Now what is meant by tie beam? See, tie beam is nothing but it is the structure which connect the anterior and the posterior pillar of the arches. Okay, so tie beam for the middle arch, which is tying the anterior and the posterior end of the arch. Now tie beam for the middle arch is formed by the muscle abductor hallucis. So abductor hallucis forms a tie beam for the medial arch. Okay, for lateral arch, the tie beam is formed by lateral arch. The tie beam is formed by abductor digiti minimi. Abductor digiti minimi for lateral arch. Next, sling support. Now, what is meant by sling? So slings are nothing but tendons from the leg region. They come to sole. Now this is foot. Okay. So now we have tendons from the leg region. From the leg region, these tendons, they go to sole in the medial side and the lateral side. Okay. So slings are nothing but the tendons from the leg. They go to sole on the medial side and the lateral side. Now by going on medial side, lateral side, they pull the arches on the medial side and lateral side and thereby increasing the concavity of the arches. Clear? So slings are nothing but tendons from the leg. They go to the sole. and they pull the arch on the lateral side and the medial side, and thereby increasing the concavity and thereby maintains the arch. Now, what are the tendons on the medial side? Now, what are the tendons on the lateral side? The tendons on the medial side helping for maintaining medial longitudinal arch. Tendons on the lateral side helping to maintain lateral longitudinal arch. The main tendons on the medial side helping for the medial longitudinal arch. What are those? Tibialis anterior, tibialis posterior. And also by flexor hallucis longus, and one more muscle we have, flexor digitorum longus. Now these muscles, these tendons, they're helping for medial longitudinal arch. Tibialis anterior, tibialis posterior, flexor hallucis longus, flexor digitorum longus. Now out of these four structures, what is the best structure? What is the best tendon which is giving the sling support to the medial arch? Tibialis posterior. Okay. Now for lateral arch, yes, we have peroneus longus and peroneus brevis. Peroneus longus and peroneus brevis. These two tendons, yes, they give the sling support to the lateral arch. Okay, right. So these are the points you have to know about the arches. You have to know the bones forming the arch. You have to know the anterior pillar, posterior pillar, summit, joint, it's a ligament support, intersegmental ties, and your sling support and tie beams. So these are the points you have to know in the arches. And that's all about the arches. And by this, yes, we are completing the lower limb.